exciting. Any folks, I'd like to invite friend and colleague Shauna Fay up to the stage for her panel presentation.
I think I get 12 minutes. All right, so I am presenting Sex, Drugs, and Bingo. Dr. Blackstock had in her path forward knowledge translation resources. So that is what I have for offer today. I just want to say I am a health educator, have been at 9 Circles for 12 years, and it really hurts me that I have to teach community members to ask for the care they deserve. And so I really need the systems to do the changing, but what we did is we developed a tool to help empower people to ask for the things that they need that they're not getting. So let's change that so that we don't have to put the burden on the folks who need the help. Okay, next slide. What's going on? We've just talked about what's going on. So HIV and syphilis are out of control, as are all of the other STBBIs that are following. Great. Next slide. What the heck can we do about it? So what I know is that workshops aren't working. People don't want to come to workshops and hear me talk. Can you believe it? So what works? Well, bingo works. Who doesn't want to play bingo and who doesn't know how to play bingo? So what we have done is figured out a way to develop a bingo for adults who are sexually active and who use drugs that can explore the topics of testing, syphilis, what's going on in Winnipeg and Manitoba, and also decrease stigma. Because we know that sometimes conversations in groups that revolve around syphilis can turn into directions that aren't as helpful. So we really wanted to try and bust stigma with this as well. Next slide. So this tool, so it's ready. Yesterday it got uploaded to the 9 Circles website. I'm going to walk you through how to download it today, but don't go to your phones yet. You gotta. Still talking. I also have 16 paper copies in the room today. So if you are here present in person with me, come and bug me at lunch because I will get you your copy. Can you hit, thank you. So why did we develop a bingo? Because workshops aren't a good fit. This bingo is not designed to be delivered by a health educator. This bingo can be picked up and played by anyone, and we encourage that. And people come to bingos and they don't come to workshops. So if you're gonna run this bingo, also get prizes. People who play bingo expect a prize. So that's on you. The kit doesn't include prizes. Next slide. So we did develop this as a part of some PHAC funding, and we used Katie information, Government of Manitoba information, and Health Canada information. So it is evidence-informed kit. This is not just ideas pulled out of the air. It was piloted by peers of people who use drugs. So people who use drugs go out into the community and facilitated this bingo with other folks who were using drugs around Winnipeg. And so what we did was we just wanted it to be quick, ready, accessible, and fun to play. So that's what's going to be in the kit today. So next slide, and I'll show you what you get. So the first thing that you're going to get is a really, really simple set of instructions. If you know how to play bingo, you don't need these. But if you're a nervous Nelly or you really want to equip your peers, this is the instructions. They're not very long. They're very helpful about what it is that you need to play the bingo. But then there's also some really great resources of places where you can download syphilis brochures or find out where the latest stats are. So that's the first thing you're going to get. Instructions. Next slide. The second thing you're going to get are these caller cards. So let me just follow along. How am I doing? I got those 2 extra minutes, right? So you're still accounting for that? 42 caller cards are in this deck. So what we did for this, instead of numbers, now these are messages. We know that sometimes reading is not an inviting activity for people. So we also coupled every single message with a picture. So if you have people who can just play bingo by following along with the pictures, that's great too. They'll benefit from the discussion that's happening in the room. And this is about partying, using drugs, having sex, getting tested for syphilis. So all of the things that are important to know, but also sex friendly, and don't stigmatize people who engage in those behaviors. Next slide. The last thing that you're going to get is a bingo sheets. We developed 11 bingo sheets just because we know that sometimes groups, large groups, can get a little hairy, especially when you're playing bingo. So it comes with 11 bingo sheets, but if you have a larger group, you can always double up. Know that you'll have 2 winners, which means 2 prizes. Or you can have people play, this table gets 1 sheet and this table gets the other sheet, or have people play in pairs. So whichever kind of groups you are providing services to, there's a way that you can play this bingo with them regardless of the size of your group. And then what we did was we made the little bingo pieces the same size as a condom package. So you don't need bingo chips, you just play with condoms. Hello. And then they get 9 condoms to take home with them. So there you are. So make sure you have condoms on the table. And everyone knows how to play a bingo. If you want a really quick bingo, because the group is a little antsy, you do 1 line. You got a really great group and the discussion is going well, you play a full house. I'm solving all of your problems here, people. You are going to want to get this from me. Next slide. So, as I said, it's only been available for download since yesterday, so not many people have had their hands on this tool yet. But Poplar River, there's a nurse in Poplar River who we meant to go facilitate to, and there was a bit of an issue. So we sent her the kit, and she is happily facilitating this in her community. West Central Women's Resource Center has also facilitated it last week, and they said they had a wonderful time playing it. So this can be played in health facilities or outside health facilities. If you are a women's center or a friendship center or wherever you're working, this can work for you as long as you have a group that wants to play bingo. Next slide, please. So, as I said, come see me. My name's Shauna Fay. My email is sfay@9circles.ca. For all the people on Zoom, you want to write that down. For anyone on Zoom or in the room right now, I'll get you to go to 9circles.ca because I'll walk you through this. On your phone, there's going to be a menu bar. Hit the menu. And then you're going to want to go to programs and services. So from the menu bar, go to programs and services. That's wrong. Abort. Go back to the menu bar. It isn't. No, I was right. Programs and services. And then community education. I was right. Once you're on community education, just scroll down. You're going to see the bingo. And then you're going to see where you can download it today. So you can download that right to your computer, print it out, and host your bingo tomorrow. So again, hopefully this will help encourage the conversation, reduce the stigma. And I would also suggest that if you're playing this bingo, it's sometimes really nice to have a clinician down the hall so that once all of the syphilis testing talk is finished, they have an immediate place to go get tested. If that's not possible, that's not possible, but it's kind of nice to have that wraparound service if you can do it. Again, I'm Shauna Fay, sfay@9circles.ca. Send me an email. Hit that website or come talk to me at lunch and I will get you this bingo. Thank you.